The first topic that I choose from finals is evaluating the impact of behavioral healthcare informatics. Introduction. Many staff in behavioral healthcare organizations struggle with understanding the impact of IT on their organizations. Often, people within the team begin pointing to the lack of tangible results even before implementation projects are complete. Some people begin to question the implementation and they express their anxiety by saying, "This isn't going to work." Others are perhaps uncertain, worried about the change their ability to adapt. Many times, organizations act to optimize or indeed focus on short-term performance measures for new technology, but the process of implementing changes may take months by itself and then even longer to realize significant results. Evaluation means making a judgment about something or having an assessment about it. Evaluation is important because it helps to find out what works well and what can be improved in a program. These questions may be precipitated by a crisis. For example, a shortage of funds, competing needs, obvious failures, and so on. Alternatively, senior administrators may want to know if they are getting their money worth from this system. In the case of a new information technology system, there is often a concern with learning whether the new system represents a good approach or if there are any changes needed. Regardless of the motives, evaluation is the way to answer those questions. Common evaluation methods. There is a noticeable difference if the investigators are from within versus outside the department, as external evaluators may be seen as more objective, but there may be a greater reluctance to discuss problems. Another assessment technique is to administer a specific questionnaire or structured interviews to ask people opinions about the program, because this appears more scientific and objective than the first type of investigation, and it does prevent the more patent intrusions of observers' biases. Finally, examining the data within the IT system itself can be an excellent method of evaluation. This has the advantages of being free of potential waiter, reporter bias, and usually much quicker. Next is benefits of evaluation. The true motives for change in most sectors of healthcare is that the new will outperform the old in some way. Examining use of information technology in informatics behavioral healthcare, studies have revealed numerous benefits. From providing access to otherwise unobtainable information, to more complete, easier to retrieve records, to better adherence to evidence-based treatment guidelines. By conducting evaluations of IT usage, organizations can see who is and is not benefiting from use of systems like EMRs. Target those providers with additional training and resources on the use of technology, allowing the organization to fully reap the advantages of such systems. This targeted training will also prevent those who are using IT properly having to waste valuable time on unneeded training, cutting into the ability to productively care for their patients. Practitioners, as the hands-on users of majority of IT, also have a large number of potential benefits from effective evaluation method. First, evaluation of IT usage can help practitioners to make sure that they are utilizing the informatics systems so it is full potential across areas such as record keeping, information access, and ease of communication with other professionals. Next is system expectations and goals. In order to complete an effective evaluation of the new information system and the implementation process, it is essential that realistic system expectation be clarified and used in evaluation process as a measure of success or failure. The system expectation should be known to all involved in the system design and selection process. The expectation need to be written in simpler declarative, capable of statements, which are in turn used to develop evaluation questions and the evaluation methodology. What do we do in the information? The evaluation of complex organizations requires the formulation of objectives and criteria of accomplishment on a much broader scale. It is generally agreed that successful evaluation studies cannot be performed retrospectively, but rather must be built into the programs at their inception for true learning to take place. This is one of the reasons why obtaining baseline information is so important to a useful evaluation. A number of considerations, therefore, must be taken into account. That is the end of my discussion.